Well, whether you're an athlete or just trying to stay active, knee pain can slow you down. Joining me today to talk about some of the causes of knee pain and what can be done to treat it, Dr. Richard Busch from Busch Chiropractic. Doc, always good to see you.
Always good to see you too, Pat.
You brought along a prop. We always like that as well.
I did. It makes things a little bit more easy to understand.
Right. Well, obviously it's a knee. How common is knee pain and what types of pain are we generally talking about?
Well, we can talk about just dull aches, or we can talk about the pain from an actual injury where you tear something. But then along with that, we also see as patients get older, we start to see wear and tear develop over the course of time, and we start to see degenerative changes. About 700,000 total knee replacements were done last year alone.
Obviously, you'd like to avoid that if you can prevent it. What are the best ways to kind of do that?
Well, there are a lot of things that we can do. We talked about a little bit ago that you can actually use orthotics to actually help change the biomechanics of your ankles and your knees and your feet. But then along with that, if that doesn't help, then there's some other things that we can do. Anything from just a regular manipulation standpoint, which is something that I do quite a bit in my practice. Where we actually are adjusting or moving the bones in your knee and ankle and foot. But then along with that, there's some other things that we use. We use something called extracorporeal shockwave therapy, which is actually a focused ultrasound. It helps break up scar tissue adhesions, arthritic changes, and it actually helps increase cellular metabolism in the area, and it causes your body to start releasing or creating new mesenchymal stem cells in the area, which actually help the healing process.
Well, what can you show us with this prop? And kind of hold it a little steady so our camera can get a good shot.
What we can see is, in a lot of cases, patients may notice that they have a tear on either the medial or the lateral meniscus, which is basically the middle or the lateral part or the outside part of your knee. But then along with that, we can have tears to the ligaments on either side of the joint capsule itself. But then along with that, as we start to look in between the joints, or if we look right here, we can see that the meniscus in there starts to wear out over time.
Okay.
And so it becomes thinner. Just kind of like anything else, as it wears out, we start to see less space develop in there. And that will cause an increase in inflammation. It'll cause an increase in degeneration. What we've known in the past for treatment for this is, in a lot of cases, they'll do things like inject corticosteroids in the area, which help with the discomfort. But what happens is it pulls all the inflammation out of the area, and it also pulls all the good fluid out of the meniscus itself, or out of the cartilage. As a result of that, we see advanced degenerative changes, and so that's one of the reasons I think it's so important for us. If we can avoid, whether it's a medication or a surgery, we can actually help the patient avoid other problems down the road.
All right, a lot of good information, but obviously something you could talk a whole lot more about. You can learn much more about the Busch Chiropractic Center by calling the number right there on your screen or heading to buschchiropractic.com. All right, Sierra, back to you.